Hi, my name is Paola Rosas. I am an assistant professor at the College of Pharmacy at the University of Illinois at Chicago. And today we just wrap up a great session in cardiac sarcomeres and cardiomyopathies, new perspectives. And so we want to highlight one of these presentations. One of the presentations was done by Dr. Elizabeth McNally, who is a professor and director of the Center for Genetic Medicine at Northwestern University. So Dr. McNally, can you tell us a little bit more about your important topic that you talked today?
Yeah, so I talked about two different things. One is the use of genetic testing to diagnose different types of cardiomyopathy and to understand the genetic causes of cardiomyopathy. I'm a cardiologist and a scientist, and I actually direct our cardiovascular genetics program at the Bloom Cardiovascular Institute at Northwestern. And so we routinely use genetic testing to diagnose patients and importantly, their family members who are at risk for developing cardiac disease. And what we've learned from a lot of testing these days is that there are subgroups of patients that carry additional risks, and the genetics can help identify those patients who have different risks, particularly for irregular heart rhythms and arrhythmias and the management thereof. And then for a smaller fraction of patients, we're now starting to see the first therapies actually be in the clinical setting where we're using different drugs to treat people based on what their primary genetic mutation is. And over the next few years, we'll see even more of that coming into play.
Thank you. So I have a question. How can precision medicine approaches improve the management and prevention of genetic diseases?
Well, I think I'm biased towards genetics. I've been using genetics for a lot of my life to help diagnose patients. And there's all sorts of different variants. When we compare any two people's genomes, there's 5 million differences. And so there are more differences than I think any of us ever really imagined. But a very small percent of those differences can really predict what is the clinical risk for people to carry. We know that can be true for cancers. We know that can be true for heart disease. It can change what the risk is for developing coronary artery disease or for developing cardiomyopathies, as we talked about today. And so I think the important part of that is to recognize how those are very individualized, precise, different genetic changes. The future is really going to be able to involve not only using that information for diagnosis, but also ultimately being able to correct those gene changes for those gene changes that really cause a lot of problems for the heart or arrhythmias. We are looking very closely at all the different methods now for gene editing and genetic correction and strategizing for how we'll ultimately use that in patients.
Well, thank you very much. So today, Dr. Elizabeth McNally gave us a great presentation, and she helped us to understand how these genetic signatures can help personalize care and inform precision screening in these patients. Thank you very much.
Thank you.